this series of videos, I am covering various topics related to the tests that are done for you when you come for a diabetes checkup. One of the most important organs which has to be tested regularly for a person with diabetes is the eye test. Now you may say, why should you do an eye test? I just changed my glasses only recently. That is a common mistake that people make. When you say an eye test, they think we are looking for the glasses that you are wearing. No, that is not there. What we are talking about is the back portion of the eye. When you wear glasses, the front portion of your eye is affected, what we call as the lens of the eye. The back portion of the eye is called as the retina. Now the retina is like a film in the camera. Now you know you have a camera, and in the old days you know you have a film, and on that all the images are captured. The retina is exactly like that. Now the retina is full of blood vessels, arteries, veins, capillaries, all these are present in the retina. Now when you have uncontrolled diabetes, what happens is that these blood vessels can get affected. And once they get affected, they can start leaking, they can bleed, small spots can come, they can start leaking protein, and in the worst circumstance, even the retina itself can get detached. Now, I have seen patients who have finished 40, 50, 60 years and have had no diabetic retinopathy. My grandfather had diabetes for 55 years. He got it when he was 44 and he died at the age of 99. When he was 95, we took photographs of his eye and he did not have a single change due to diabetes in his retina. So there are many like that who have finished 50, 60 years and have no complication. At the other end of the spectrum, we also see somebody who's got diabetes only 5 years and already the vision has started getting affected due to bleeding inside the retina due to diabetes. So both ends we are seeing. So the only way to do is to, number one, of course, keep your sugars under good control. Number two, to start the first eye examination on the very first visit when you come to our center. This is what the American Diabetes Association, the Diabetic Association of India, and all these associations tell you that the very first time when you're diagnosed to have type 2 diabetes, your eye test should be done. If you have type 1 diabetes and you're a child with type 1 diabetes, then the first eye test can be done after 5 years. But thereafter, every year, everybody, whether it's type 1 diabetes, type 2 diabetes, any other type of diabetes, every year a detailed eye examination has to be done. So that is why you'll find at our center, especially in the Gopalapuram main center, you'll find that there's a whole wing, a whole block only for diabetic eye diseases checking. We have 2 complete floors reserved only for testing the eyes of diabetic patients. What we do is, we'll first check your vision, and then we'll check whether the pressure in your eye is normal and whether you're able to read properly, and then we'll put in the drops to dilate the pupils, and with that the ophthalmologist can look inside the back of your eye and see whether all the blood vessels are normal. We then grade it and say it is normal or abnormal. If we find any changes, or in those with long duration, we'll even take a picture, a photograph of the eyes, like taking a selfie. We can just take a photograph and keep it. So next year when you come back, suppose there are some minor changes, we'll know whether these changes are increasing, remaining the same, or they have gone away. The good news is that if you control diabetes very well, even the minor changes, what we call as diabetic retinopathy, early changes, can completely reverse. On the other hand, if you don't check and you don't look at it at all, there is a possibility that this diabetic retinopathy can go from mild to moderate to severe, and then it can go to the stage of proliferative retinopathy, and these are the people who run the risk of going blind due to diabetic retinopathy. Over the years, I have been in practice now for almost 45-50 years, I have seen that thanks to good diabetes control and thanks to regular checking of the eyes, blindness due to diabetic retinopathy has begun to come down. But unfortunately, still we lose some patients' eyes because they just neglect, they don't come back for a checkup, they don't control their diabetes or their blood pressure, and we still find, unfortunately, people going blind due to diabetic retinopathy. So even if we have forgotten to check your eyes and 1 year has passed since your last checkup, you please remind us and say, my eye checkup is due, and that way we can see that your eyes are fully protected despite many years of diabetes. Thank you.